Hello, my name is Rebecca Clark and I am with the ANTHC Immunization Program. This video will review the 2017 changes to state-provided vaccine. First, let's review the Alaska Vaccine Assessment Program, or AVAP. AVAP provides funding for all vaccines federally recommended for insured children and for certain adult vaccines selected by the Alaska Department of Health and Social Services. By collecting payments from health plans, insurers, and other responsible entities, and remitting those funds to the state of Alaska, healthcare providers can receive state-supplied vaccines at no charge. Access to immunizations is a challenge for uninsured adults, which is approximately 18% of the adult population in Alaska. Providers have the option to act as a safety net by opting in for their uninsured adult population. To opt in, providers pay an assessment for their uninsured adult population served. Providers who opt in can receive state-supplied vaccine, which can then be administered to uninsured adults. Please contact your regional immunization coordinator to determine if your organization has opted in for 2017. The Alaska State Immunization Program uses AVAP funds along with Vaccines for Children Program, or VFC, to provide all federally recommended vaccines for children. This means that all children can receive state-supplied vaccines. Please note that for vaccination purposes, children are considered age 0 to 18 years. Adults 19 years of age or older may receive state-provided vaccine if they have a health insurance plan under one of the participating payers. Most insurance companies opted in to the AVAP program this year. If your organization opted in for uninsured adults, then uninsured adults may also receive state-supplied vaccine. The vaccines that the state provides for adults include 9-valent HPV, or Gardasil 9, and this is for females 19 through 26, males 19 through 21, and high-risk males 22 through 26. Influenza or flu vaccine for adults 19 years of age or older. MCV4 or Menactra for those 19 and 20-year-olds. MenB or Bexsero 19 through 20. PPSD 23 or Pneumovax for those 19 years of age and older. TD and Tdap for those 19 years of age and older. And Zoster or Zostavax for those 60 through 64 years. 4 payers are not participating in the AVAP program for 2017: Medicaid, Medicare, TRICARE, and Prudential. Adults who only have Medicaid, Medicare, TRICARE, or Prudential are not eligible to receive state-provided vaccine. This means they will need to receive privately purchased vaccine, or a vaccine that your organization purchased. If you have an adult that has 2 health insurance plans and one is a participating payer, for example, you have an adult with Medicare that also has Aetna, you can provide state vaccine to that adult. Some organizations, like ANMC, have marked privately purchased vaccines to indicate to staff the vaccine was purchased by their organization. Check with your immunization coordinator or pharmacy to see if your organization does this. Understanding which vaccine supply the vaccine came from is important for vaccine documentation. In order for your organization to be compliant with state expectations, you must screen children and adults for vaccine eligibility. Vaccine eligibility must be documented on both children and adults. I want to take a moment to discuss the different eligibility options. Ineligible private is only used when providing a private vaccine, that is, a vaccine that your organization purchased. For adults receiving state-supplied vaccine, select State Vaccine AVAP. The only 2 options you should select for anyone 19 years of age or older are Ineligible Private for privately purchased vaccines or State Vaccine AVAP for state-supplied vaccine. It gets a little more complicated with children since you need to screen for Vaccines for Children or VFC program eligibility first. The Vaccines for Children program is a federally funded program that provides vaccines at no cost to children who might not otherwise be vaccinated because of an inability to pay. Children 0 to 18 may be eligible to receive state vaccine due to the VFC program. Please note that VFC underinsured FQHC is only a selection option if your site is a designated federally qualified health center or rural health center. This is a specific designation. If your site is not an FQHC or RHC, then you can select state vaccine AVAP for underinsured children that do not otherwise qualify for the VFC program. If a child meets more than one criteria, CDC requires VFC Medicaid if the child is on Medicaid. Please note that if you have a child that is not an Alaska Native child and does not otherwise qualify for the VFC program, then you should select state vaccine AVAP. Remember, none of the VFC options should be selected for anyone 19 years of age or older. If you have questions or concerns about the VFC program, eligibility documentation, or vaccine supply, please contact your local immunization coordinator. That concludes the 2017 changes to state-provided vaccine. For immunization-related questions, please contact your local immunization coordinator. Thank you for your participation.